I want you to imagine a moment that every one of you fears, but most never actually see. A medical assistant knocks on an exam room door and steps inside. It's routine, it's quiet, it's the kind of moment that happens hundreds of times a day in your clinic. But then something shifts. The patient's jaws tighten, their voice rises, their frustration about insurance, wait times, pain, fear, or just something happening far outside this building suddenly explodes in the only direction it can go. And now, your MA is standing alone in a small room with someone who is no longer calm and no one else is there to help. Their pulse spikes, their mind races, and in seconds, they're forced to make decisions that can determine whether the situation stays controlled or becomes dangerous. And here's the part that should concern you most. Most medical assistants are never trained for this moment. My name is Wendell Pear. I work in patient care, and I've stood in those rooms. I've watched calm interactions flip into chaos. I've watched MAs try to protect themselves, protect the patients, and protect the clinic, all while silently thinking, I was never taught how to handle this. I'm not here to criticize your leadership. I'm here because I care about your staff, your patients, and the safety of your clinic. And I know you do too. That's why I'm asking you to take one action that will make an immediate difference. You must implement mandatory de-escalation training for medical assistants now, not later. Today, I'll show you two things. One, the problem. Aggression to a frontline staff is missing. Two, de-escalation training works and the evidence proves it. Let's start with the reality we're facing. According to a 2024 report from the National Institute for Occupational Safety and Health, healthcare workers make up only 10% of the U.S. workforce, but experience 48% of all non-fatal workplace violence injuries, almost half in one industry. And your medical assistants, they're the first faces patients see. They're the ones absorbing frustration about wait times, insurance, scheduling, delays, all the things they didn't cause and can't control. Yet most clinics still expect MAs to handle escalating behavior with zero formal training. OSHA warned back in 2016 that many healthcare facilities lack structured violence prevention or de-escalation programs. 10 years later, many still do. So when a patient starts yelling, stepping forward, or losing control, your MAs are left to improvise alone in real time. That's not fair to them, and it's not safe to your clinic. Now that we understand the problem, let's look at the solution. De-escalation is not a personality trait. It's not just staying calm. It's a teachable clinical skill, and the research proves it. The American Medical Association reported in 2016 that when your staff aren't trained, they're more likely to freeze, react emotionally, or accidentally escalate the situation. Not because they're unprofessional, but because nobody taught them what to do. Training gives MAs the tools to keep a natural tone, give space without signaling fear, recognize early warning signs, protect themselves and others if danger arises. As reported by BMC Nursing in a 2019 study, found that nurses, nursing students, psychiatry staff, and general hospital staff all reported higher confidence after de-escalation training. And confidence matters. When you know what to do, you don't freeze, you don't panic, you don't de-escalate, you respond safely. According to a 2016 article published by the American Medical Association, clinics that implement violence prevention programs see fewer injuries, higher staff satisfaction, better patient experiences. And here's something else healthcare leaders understand. Turnovers cost money. Replacing one MA can cost the clinic $15,000 to $25,000. But when staff feel trained, protected, supported, they stays. And that stability benefits everyone. Patients, providers, and clinics all alike. In conclusion, medical assistants are essential to patient care because they're being placed in situations they're not trained for. The evidence is clear. Violence is rising. Training works. And clinics that invest in it see real improvements. So here's my call to action directly to you. You must implement mandatory de-escalation training for your medical assistants now before someone gets seriously hurt. Don't wait for a crisis. Don't wait for a lawsuit. Don't wait for another inmate to quit because they feel unsafe. Investing in this training means investing in your staff, your patients, and the future of your clinic. Thank you.